Welcome everybody to our kickoff event of Don't Give Up, New Approaches to Mental and Physical Health. And really it's not a completely new approach, it's just a new way of looking at it. So that's why I'm here and that's why I want to tell you a little bit about it. And what we'll see today is first an introduction. Who or what is DocChristine? And what are the diseases of our civilized world? The three main causes of dis-ease, what really it is, and I introduce the barrel model. That's not well known in the English-speaking room, and my mental and physical health triangle. And I'll talk a little bit about what I feel is wrong with our healthcare system and what could change maybe to use the allocated money in a better way for the clients, patients. And of course, I'll be happy to answer any questions and get comments and feedback. And I got some interesting feedback before the event. And I thank everybody that took their time out of the day to come today. It is wonderful to have every one of you here. Now, who are we? DocChristine is my company. I'm Dr. Christine Sauer, a German-trained, conventional, as well as naturopathic physician, dermatologist, allergist, family doctor, lots of qualifications. Now you would think I'm swerving somewhere on top of the world. No, I'm not. I'm very down to earth. And I'll tell you a little bit about my story. I was born and raised in Germany. I knew at a very young age I wanted to be a healer. And I grew up, became a physician, married a physician, had children, and did my ex-husband's practice. He was an excellent family doctor. He did a lot in his practice. In Germany, family doctors do often ultrasound, stress tests, cardiograms, small surgery, of course, house calls, night shifts, emergency. I was all part of it, and it was lots of fun. And then I became a dermatologist, mainly because my ex-husband said there's more money in it. And it was very interesting to learn about skin diseases, allergies, and we both were also naturopaths. Because in Germany, you can take additional courses and then be a conventional physician and a naturopath. And in Germany, actually, you can prescribe herbal medicines and even homeopathic medicines on the healthcare system. Interesting. So what happened? At some point, I worked 16, 18-hour days, first in my own office, seeing 80, 100 patients a day. In Germany, there's 5-minute medicine. It works because you have 8 or 10 employees that work for you. Then when I came home, I worked some more in my ex-husband's office, did the bookwork, and the kids were thankfully at the grandkids, but at some point they came home. So I was hopelessly overworked, frustrated, stressed out, and something had to give. For me, it was my back. At some point, I sat down on my office chair, pain came in my back, and I said, now you're one of the 80% that are suffering from back pain. Didn't think much, but continued to work. In the evening, I could hardly tie my shoelaces. I dragged myself home to bed. Next morning, I couldn't get up. I couldn't get up, not even to go to the bathroom. So my husband called his friends from the ambulance, and they carried me down the steps, put me in the hospital where I learned to walk again. Now, from being a doctor, worse roles as a patient, and of all kinds, not being able to get up even for the most basic functions, and yes, I mean to pee and poop in bed, was very humbling, devastating, and embarrassing. I never had experienced it, and it's a very interesting and humbling experience, and I must say every physician should experience it. Now, when I came out, I learned to walk again. After 4 weeks, I could walk. I went in a rehab program, started to work again, first part-time, sold half of my practice. But then, boom, second disc slipped. Back I was in physical, emotional pain. And this time I gave up. I sold my practice and I was home. I fell into a deep depression because I had nothing to do. My ex-husband, as good as a physician he was not a good husband. And I learned, as many people do in my childhood, to soothe emotional pain with food. And believe me, the German cakes are good. So I ballooned. And that didn't make me more happy. And on top of all, my ex-husband decided to commit suicide. So I was left sick, depressed, with 2 teenage sons and immigration papers to Canada. You see, 3 years earlier, we had applied to immigrate because we didn't want our sons to have to serve in the then compulsory German army. Yeah, life suddenly made a turn, and I decided to come to Halifax. It turned out to be the best decision of my life, but at the time, things got worse because I was alone, isolated, with 2 demanding teenagers that are not supportive, that were lost themselves, and I was so depressed that at some point I decided to commit suicide myself. And I aimed on the 102 at a bridge pillar. But a little inner voice in my belly told me, no, you don't want to die, you need help. And I'm very grateful I listened to that voice. And I went to the emergency room, and I was very fortunate because the resident realized how bad I was and admitted me to the Abbey Lane, where I spent the next 4 weeks. That's a long time for our healthcare system, I learned. And most of the time I spent listening to John Denver music, which I love. Then I learned to see him and listen to him because I could understand what he was singing. And I waited for the medications to kick in. After a few weeks, they did, and I felt a little bit better. They transitioned me to the day hospital. And I must say, it was a very interesting experience for me, not only from being a doctor to be a physical illness patient, but now to be at the lowest point in a mental hospital as an inpatient in an asylum or whatever you want to call it, mental hospital. But it was good. It taught me a lesson. Life has surprising turns. And it was very surprising that I, half year later, met my now husband, lovely Mike, who stuck with me through all the ups and downs and all the struggles. And the struggle it was, because I was still in a lot of pain physically from my back, and my mental health was up and down. Yes, I took medication, but I never was really happy. I tried different things. I studied business administration, became an expert tax preparer. It was somewhat interesting, but not my passion. So at some point, I decided to make a change. Because I said it can't be that I'm going to the pain clinic twice a year, getting epidural steroids, getting osteoporosis from it, and just going downhill, spending time in the mental hospital off and on, and just going downhill and downhill. So I said, that has to stop. And I knew enough, but I didn't apply it. So I decided to apply it, changed my lifestyle, changed my nutrition, added supplements, changed my thought patterns, and I got better and better. And I discovered my passion, and then I thought, what can I do in Canada? Because I could have gone back to Germany, and I considered that, but my dear husband He's from Halifax. He's not suitable for life in Germany at all. So that keeps me definitely in Nova Scotia, and the friendly people and the lovely landscape, and the climate is not that bad. And so when I came to Canada, I tried to get licensed as a physician and took the exams that they said I had to take, but then they told me I had to take a residency, and I couldn't do it because of my illnesses. And now, 10 years later, it was too late. So I decided to become a health coach. Hey, I thought that solves the problem, but I had to learn the hard way that the title health coach doesn't make you any money. So, but it was my passion, and I'm fiercely determined to help as many people as I can afford. And that's what I'm doing now, and I'm happy and healthy. And I want to show you a few pictures of my journey and where I'm now. That was me in 2005 at my heaviest, 315 pounds. I smiled, but I wasn't happy. And I decided at that point to have gastric bypass surgery, which we went to India for, because they didn't do it in Nova Scotia and nowhere in Canada, and it was way too expensive in the States. Very interesting trip. And that was me in 2015. Well, I might have put a few pounds back on, but not too many. That's me in my garden. I love to garden. That's my dear husband at our 19th anniversary. It will be 20 years this year that I'm with him. That's my lovely backyard chickens. Love my chickens and my husband. Those are our dogs. The one on the right sadly passed away a few months ago, but the left one is still alive. But he's an old guy, about 94 people years. Wow. But we love our dogs. That's my motto. Don't give up. There's a light at the end of the tunnel for you too. And many people in North America have really never been in Europe. And I remember when I was young, lived in Germany, my parents often took me and my brother to Italy because we wanted to play in the sand. There was no ocean in Germany. So we went to Italy through the Alps, and those tunnels are a mile long. So when you get into one of those tunnels, it's dark. You can't see the light at the end of the tunnel. And you stay in the darkness for a very long time. And then, at the end, a sudden turn, and the southern light brightens your spirit. So that's the picture I imagine when I talk about the light at the end of the tunnel. And there is a light. Now, it's up to Jennifer to share a little bit about her.
Well, my story is not quite as profound as Christine's, I guess, but so I'm Jennifer Goguen. I work with Christine. I'm originally from Newfoundland. I grew up there, went to university. Then after I graduated, I decided my brother has lived in Halifax, so I decided to come up and further my education and go into the IT world. At the time, I didn't realize, but the market kind of crashed and it was oversaturated. So I found myself kind of just working in some different desk jobs and some admin work, and eventually found myself working as an insurance underwriter for 10 years. But at around the time when I reached 40, which was just a couple of years ago, I kind of thought, well, I've got about at least 20 years probably left to work, so what do I want to do? So I kind of thought on it for a while, and I was always interested in food, but not necessarily as a chef or anything like that. But a good friend of mine, who's also a chiropractor, would talk a lot about alternative health and holistic practices and different things she was doing with her family. So I thought I was getting really interested in that, and a lot of my past struggles were with my skin. I'd always had bad acne ever since I was about probably 15. So kind of got tired of all the conventional medicines from doctors, dermatologists, and I thought, I think I'm going to go see a naturopath and just get a different take on it. Sure enough, it turns out that one of my favorite food groups that I'd been eating my whole life, dairy, wasn't so good for my skin. So I made some changes, and the more that I kind of started to learn about all these different things, and I thought, okay, I think this is for me. So turns out I enrolled in the same program that Christine had done. She had finished at the time when I was still going through to learn to be a health coach, and that's how we met. So we were at a group of us had got together and that had done the same program. So that's how Christine and I met, and so here we just have the faces kind of blurred out. My husband and my two boys that are 8 and 5. So now I kind of have a new perspective on things, but also a new issue that I'm dealing with in my family. My 8-year-old just recently, over the past winter, got diagnosed with ADHD, and he's on the autism spectrum. So I thought, okay, what am I going to do? So not really comfortable with just doing just conventional medicine, because thanks to Christine and other people, kind of found out a lot of different information that could be affecting these types of symptoms. So that's really where I'm at right now, and Christine and I are going to be working on that portion of things coming up in the next little bit. So yeah, that's a little bit about me. And
thank you so much,
Yeah.
Jennifer. And she's a wonderful person, a proud mom, and a
That's right.
proud wife, and she has a garden too.
I do, mostly herbs for me.
Yeah.
That's a little bit more my specialty.
Hey, I love veggies, you love herbs, it's perfect. Now, what are we talking about today? Are choices. We both made choices to not just go with conventional medicine. Now, I do not say anything bad about conventional medicine. We need conventional medicine. Before we had conventional medicine, science-based, whatever you want to call it, we had the herbs, but the people died like flies from infections in young age, from things like appendicitis. So there is a very big benefit in conventional medicine. I'm a conventional doctor enough to value that. On the other hand, in my opinion, there are diseases of our time that, oops, that's the wrong way. That's the wrong way. Come on, you stupid thing. It is always the computer, never the operator. So what is dis-ease? Obviously, it is not being well. But there are certain diseases that came up in our civilized world that have risen in the last 20 to 50 years enormously in frequency. Especially, so many people nowadays complain about fatigue, brain fog, chronic pain of some kind, food allergies, autoimmune diseases, skin problems, eczema, even in kids, autism, ADHD, memory problems, Alzheimer's, down in the dumps, mental health, depression, and so much more common. And of course, stomach problems, bloating, who doesn't have it nowadays? And inflammation is one of the causes, but there's others. And I'll lean a little bit of what Dale Bredesen says in his excellent book, The End of Alzheimer's. The 3 main causes of disease in his world are inflammation, toxins, and nutrient deficiencies. Now, every one of those 3s, you can have subtypes of another 12 or 15 that can cause that again. So it's a very complex matrix that of different reasons and collaboration of different causes that works together to make us sick. That's the barrel model that I really like, because we get told it's because we get older, it's genetic. My take on that is genes do not change in 100 years. Genes change over thousands of years. It's not our genes. It is what they call epigenetic. Epigenetic is an interaction of genetic dispositions and environmental influences. And it is the gene expression that varies. And that can happen within a generation, that the same gene that maybe 100 years ago made this harmless protein now suddenly produces something that is harmful to us. What does a barrel model mean? We all are born with a barrel of a certain size. That's the genetics. There's little barrels, people with little barrel born, and they don't have to be little people. And there's people born with a large barrel. Now, every barrel has a little spout, and the spout varies also in size. And a little barrel can have a big spout and vice versa. And what it symbolizes is what reigns in the barrel are the environmental influences, toxins, and more. And I'll show you what fills the barrel. And the spout and what comes out are our detoxification systems of the body: liver, kidneys, bowel, lungs, skin, and their derivatives, lymph system, and accessory organs. So if the spout is blocked or it rains too much, the barrel will fill up. And a small barrel will fill up faster than a big barrel. And that's how I explain that some people can eat junk, have stress and smoke and dope all their life and get 100 years old and stay healthy and well. Those people exist. They happen to be born with a real large barrel. I like that picture. And what is filling your barrel? The rain. There's just a few reasons. Environmental toxins. To our food system, in the last 100 years, 80,000 toxins have been added. Only a few of them have been studied, and not all together. And we are the soup of toxins that we are eating, drinking every day. We can only escape some of them. Malabsorption is rampant. So many people maybe even eat healthy, but they do not absorb it. And we are not what we eat. We are what we absorb. We are what really reaches our body. Then inflammation can be caused, on the other hand, by toxins and stress too. So it's a interaction of everything. Not enough exercise, stress fills our barrel, relationship problems. It's a form of psychological stress, toxic thoughts that stress us out, too much worries. Then, of course, if our gut bacteria are out of whack, dysbiosis, infections. We all know about Lyme disease now. Brain chemistry abnormalities fill our barrel. Nutrient deficiencies fill our barrel. Malabsorption, smoking, one of the most common toxins, and medication don't have to, but can fill our barrel. Especially if, like, for example, proton pump inhibitor, they cause, that's the heartburn pills, like Prilosec or Nexium, they cause the body not to absorb certain nutrients that we absolutely need. When do we get symptoms? Our barrel fills up for years and years, and we might be feeling fine. But we get sick when the barrel overflows. There's a German saying that I like, that is the drop that makes the barrel overflow. That is equivalent to the English saying, the straw that broke the camel's back. That doesn't make much sense in my mind. I like the barrel that overflows, because the moment the barrel overflows, you have disease. Suddenly, you get your heart attack. Suddenly, you get memory problems. Suddenly, your skin breaks out. It happens because over the past 10, 20, 30 years, your barrel slowly filled up, the spout got blocked, and it overflows. Of course, traumatic events can poke a hole in the barrel and make it overflow earlier. And what conventional medicine mostly does is it mops up the spill. But it does not influence the filling level of the barrel. So when we look at that, what we can do and should do, what's my opinion is, reduce the rain, if possible, as much as possible, and unblock the spout. Because we can't change the size of the barrel, that's we are born with. But we can change the amount of rain, which is the standard American diet, the toxins, and all that I mentioned. Let's see, come on. That's my pet peeve, the mental and physical health triangle. And people don't realize, especially for mental health, that the body, the physical part, plays such a big role. When somebody is depressed or even schizophrenic, which is a serious illness, I have both, by the way, I've been diagnosed with both. The body, if it doesn't work, if the physiological systems are out of whack, if the brain doesn't have the nutrients it needs to function, the vitamins, the amino acids, and way, way more, no wonder it doesn't work. The same, the brain is 60% fat. The low-fat craze that we all were on since the 70s made it worse. No wonder we can't think anymore. The toxins in our diet, in our food, cause inflammation. And inflammation and the infections together cause the brain to react and say, I have to do something. Then it produces what we call amyloid, and that produces Alzheimer's. It's all a consequence of modern time. And I won't say it's 100% only that, because those diseases have been there for thousands of years. I won't dispute that, but not as much. I think the increase is that the rain has increased. And for me, the solution for the mental health, and what is not addressed in our system at all, is the physical part. We give them medication. We do not address the nutrient issue. We do not address the toxicity issue at all. The inflammation issue, same thing. And I feel the mind part, yes, the mental health, I don't say anything about counseling. There's great counselors out there, and we need them. But it's not the only thing. And any counseling will fail when the brain can't react to it, because it doesn't have the nutrients. And we fail to lay the groundwork for it. That's something I want to advocate for more, to consider that part of the mental health triangle more. Same with the spiritual part. It's often neglected. But we need to know what our purpose is. We need to have a connection to the universe, God, Allah, whatever we believe in. If we don't have a purpose that lifts us up every day, why would we want to get up out of bed? It's not a life well lived when we sit on the Chesterfield, watch TV all day. I would get depressed then too. And I was when I did that. Not a good idea. Now, my ideas. What may be wrong with our healthcare system, in my view, and yes, it is my view. There's other people that have similar views, but I think in our healthcare system, only conventional medicine is supported and paid for. Which is great. If you fall down, break your arm, perfect, you need it. But in the chronic diseases, often we just cover symptoms and maintain sickness. And there's no funding for naturopathic, complementary, and alternative approaches like massage therapy, chiropractic, acupuncture that are proven effective. For myself, my back was treated by epidural steroids with the conventional system twice a year, which was a day surgery, CAT scan. So I would say each appointment cost the health system at least $1,000. Then I transitioned to my current chiropractor, and I pay him about the same that I cost the health system. But now the health system saves the $2,000 that it paid out for me, and I don't get it paid for the chiropractor. And they might even have saved on the long term. I don't know how much it really costs. We don't get told. We should be told, I feel. And I don't think the system would cost more if we would work better together. The same ad where you are there, my massage therapist. I was diagnosed with ulnar syndrome. It's like a carpal tunnel for the elbows. Went to a neurologist, did the test, says yes, the elbows. The only thing possible is surgery, same they tell you for carpal tunnel. So I tried it on my right elbow. Didn't help. So the left elbow, I said, no, I don't go for surgery. I met him. He works on my elbow. This is nearly good. You can treat it. Why don't the neurologist know that and send me to him first, or to somebody like him that does stuff like that, before sending me for surgery? That is a deficit I see. And we focus on averages, normal, and statistics. And you might know my pet peeve, the statistics. Who is the statistician? What is it? It is a person that has his head in the oven and the foot in a bucket of ice and says, on average, I feel great. We focus on pharmaceutical pills, which I feel mop up diseases instead of emptying the barrel. We focus on science often as a dogma and don't allow alternative use. And studies are sadly often funded by specific interest groups. I will not name which ones, but everybody knows which ones. And I always say, don't trust any statistic you didn't falsify yourself. There's a lot of that going on. So a certain person is not totally wrong with fake news. I think he just has a problem of distinguishing which ones are and which ones are not. Now, what can be, oops, it goes in the wrong direction again. Oh, come on. That's the wrong direction. Come on. Be a good boy. Or girl, whatever. Just a computer. As I said, it's always the computer, never me. What needs to change, in my humble opinion? We need more cooperation, integration, and collaboration instead of competition and parallel work, which doesn't help anybody. I think we need to focus more on the individual and optimal health, which can be called prevention, but prevention is not all. We need to empower the patient or client as expert for his or her own body, mind, and spirit. In my opinion, everybody is the leader of their own life, and as soon as they're adults, and are specialists for their own body. I've heard doctors tell a patient, I know you better than you know yourself. When I hear that, I shake my head. I said, that doesn't make much sense. I've also had doctors tell clients, what are you using? Are you using anything natural? I mean, sorry. I told the client to tell the doctor, yeah, I use water. I mean, we need intelligent, integrated, and individualized health planning. And we need to focus on reversal of chronic disease instead of maintaining sickness and covering up symptoms. And it's possible, and it's not that expensive. I read in the literature, oh yes, they find out diabetes is inflammatory. Hey, so great, finally they recognize it. Then I read on, and as a consequence, they don't recommend doing anti-inflammatory measures like diet or supplements. It's all out there. No, they want to give people those new biologics, you know, those injectable that cost $10,000 a month or a year. I just say, oh my God, where are we? Okay, my pet peeve. Now, again, the wrong side. It must be the computer. As I said, I want to leave you with my motto, don't give up. There's a light off the end of the tunnel for all of us. Oops, you can't even see it because I'm on the wrong side. I'm always on the wrong side. Okay. Thank you very much. I'm always grateful for questions, suggestions, feedback, and input. Thank you so much.